afternoon, everyone. My name is Tina Verona. I'm the Director of Media Relations at Hartford HealthCare. Thank you so much for joining us for this media briefing we have. I'm sure you've seen in our alert that we sent out, we are bringing back our daily media briefings. We will hold them every day at 11 a.m. We will assemble a group of experts, a panel that you see before you. We do encourage you to come with your questions, to ask your questions, as this will be the only time that we have our experts available due to the surge in COVID-19. So we do want to make sure that you have access to our experts and that you do get your questions answered. So the way that we're going to do this is if you write your questions in the chat, we will make sure that we get to them in the order that they're received. So without further ado, we have assembled Dr. Ajay Kumar, our Chief Clinical Officer. We also have Dr. Jim Carden, our Chief Clinical Integration Officer, Dr. Ulysses Wu, Infectious Disease Specialist for Hartford HealthCare, and Keith Grant, APRN, Director of Infection Prevention at Hartford HealthCare. Lots to get to today. We're going to turn things over to Ajay, who will give us an update on the system and where we stand.
Good morning, Tina, and good morning, team. I hope everybody's doing well, and Happy New Year to everybody. Jordan, I see your question. We'll come to that in a moment, but let me begin with some of the status update about where we are as a system. So Hartford HealthCare continues to manage this surge rather well. We are blessed with the integrated system across the state of Connecticut, where we are able to support each other and manage the surge, especially in hospitalization, through a centralized process. So as of this morning, we have 389 patients across the system. Out of that, it's really important to note that 53 of those are in ICU. Now, if I was to contrast this to back in first surge, when we had about 425 patients across the system, we had 128 people in ICU at that time. So it's a little less than 50% of the people are in ICU at this time, given the similar number of individuals across the system. Now, we do have Hartford Hospital with 141 patients, which is rather high. Bacchus Hospital has 33 patients. Charlotte Hungerford has 33 patients as well. Midstate has 42 patients. Natchog Hospital has 4 patients as of right now. St. Vincent, 56, and Hospital Center Connecticut, 62, and Windham Hospital has 18 patients. It's really important to note that when we look at the capacity across the Hartford HealthCare, we do have capacity in our critical care and floor beds right now. Our EDs are busy. And what we're seeing right now in emergency room, a lot of patients coming in either for mild symptoms or sometimes only testing, and they're generally requiring some care. So one of the messages I would pass, and I will ask Ulysses and Keith to expand upon later on, is to the community member. We do have access through our virtual health and medical group. Our Go Health provides a wonderful access as in terms of urgent care. But if you are symptomatic and if you're feeling okay, do consult with your primary care doctor. And it's a good thing to begin with isolating yourself and making sure you don't travel unnecessarily looking for testing and other things if it can be avoided. I know the state is working very hard in creating more testing options through rapid testing, and Dr. Carden will expand a little bit more about Hartford HealthCare's effort, but that would be one of the messages I would pass. With that, Tina, I'll pass on to Dr. Carden maybe to talk about testing, and we can get through the rest of the discussion as well.
Yes, thanks, Ajay. And thank you, everybody, for joining. Understand we find ourselves back here again with, dealing with another surge. From testing capacity, we have had in place testing at Newington for a drive-through trailer. We've expanded those hours. They were open over the weekend, and we'll continue to expand those, as well as a second site at 61 Hart Street in our HOCC campus area. In addition to that, going live this week, actually, St. Vincent's on the 7th will be up and running with a trailer testing capacity there. And then next Monday on the 10th, we'll have additional trailers both at Charlotte Hungerford, Windham, and Stodd Avenue as that goes forward. We would then, if those are all up running, we will continue to assess whether we need to add additional 2 other locations that we are actively pursuing right now is a Midstate and another trailer at HOCC. That should give us a pretty well ground game in terms of broad coverage. From there, if we need to add additional trailers at any of our sites, and these are on our locations, so we have the capacity to do that, we can further to expand. We are trying to dovetail with what the state is doing as they are considering their plan forward. Following, when Semaphore Lab is going to withdraw, they do have plans. And so our hope is that with our supplemental testing that we will be rolling out and what the state and the others have, we should be able to cover that. I want to make sure that we also understand that this is not, it's a little different than we just had the massive drive-throughs. We're also currently testing through the medical group. They do their patients so that there's access and availability other places than the standard centralized kind of locations. These are for people who certainly are symptomatic. These drive-through trailers are very helpful for, as a lot of asymptomatic testing can be done and is available not only in our offices, but at the lab and Quest patient service centers. Lastly, as Ajay pointed out, we are very much focused on, it's not just the testing, but it's the clinical care and recommendations and guidance. We will continue to ensure that we follow up on everybody who tests with us to ensure they are connected to care, but also want to make sure it's available as people are more and more testing at home with the rapid antigen test. Sometimes they're just looking for guidance and clinical expertise on what to do next. And we are ensuring that we are making that available through our virtual healthcare component with the medical group. So I'll stop there and turn it over to Ulysses and Keith. Tina, if that's the next step.
Yeah, that's the next step. Thank you, Dr. Gordon. Ulysses, Keith, breaking news that we just heard the FDA cleared boosters of Pfizer vaccine for 12 to 15-year-olds. So lots of things happening. Do you guys want to add any opening remarks?
Yeah, I'll go if that's all right, Keith. Just really quickly, not much to say after what Dr. Cardin and Dr. Kumar have succinctly summarized. So I think a lot of the questions are going to probably revolve around, Omicron and Delta, and I'll get to that in 2 seconds. To talk about the 12 to 15-year-old approval, I think that's just another benefit for us, and it's another way for us to combat this. As we know that some of the vaccinated are certainly getting infected, what we used to call the breakthrough infections, but remember that vaccination has never been the prime reason to get vaccinated was to prevent severe morbidity and mortality, to keep them out of the hospital. I think it does decrease transmission to a certain extent, so that is an added side benefit. And I think approval for this age group will continue to help us in our fight against COVID. With regards to Delta and Omicron, I'm sure we're going to get questions. I'll just try to nip it in the bud. I do believe that we still have circulating Delta. Now, it's difficult to distinguish exactly what illness is Omicron, what illness is Delta at this point, but I do know that out of the isolates ending at this point last year, there were still a significant amount that were actually still Delta. So it is still present in the community. Now, we've always said at Hartford HealthCare, we are approaching both variants exactly the same. It does not change our operating model, how we approach this disease. Omicron, although it may have the ability to be more infectious, although it may be more mild, its infectivity still could drive people into the hospital at this point. And I think we are probably seeing some of that within the hospital. But right now, we are focused on Delta and Omicron, treating them both. It does not change our approach. I think that's pretty much it. Keith, I'll turn it on to you.
Yeah, so Ulysses, I think, good summary from everyone. We're seeing obviously higher numbers than we've seen at this point in time. And obviously we have a more infectious strain of the virus. Additionally, we've also seen a number of concerns from people being probably just a little bit fatigued on certain mitigation strategies to include masking. One of the things that we've had a lot of conversation about is efficacy of specific masking. There's a wonderful study that came out from Yale that talked about the cloth mask, and probably we need to sunset cloth mask at this point in time. Again, we want to stress, vaccination is key. We've seen a number of individuals within our institution, patients coming into the institution, the majority of patients across healthcare institution in the country right now are unvaccinated at this point. We continue to see I shouldn't say very limited, but still 25 to 30% for breakthrough cases across the country. The masking still very important, preferably not a single tier mask, but the blue normal procedural mask is a good mask to use. But as we continue to say, this is a disease, I don't want to say disease of the unvaccinated at this point in time, but we're seeing a significant impact on our population that is not vaccinated.
All right, thank you, Keith, and thank you everyone for your opening remarks. We are going to turn it over now to the media for their questions. We do have a lot coming into the chat. We're going to take the first one from Jordan Fenster with First Connecticut Media. How many Hartford HealthCare personnel are out? Ajay?
Yeah, Jordan, thanks for asking this question. I think what's most important to know that none of our services are being affected because of staffing issues or shortage at the moment. Pretty much every single service, whether it's outpatient or inpatients, are working in full capacity. We don't have the exact number right now. As you know, it changes every day given the testing and quarantine and other discussions ARC Health has to have. But most important thing to know that we have full capacity to manage all the services at this time.
Our next question comes from Jenna Carlesso from CT Mirror. How many children are hospitalized with COVID across your health system? And of those, how many are in the ICU?
Jenna, Hartford HealthCare does not have a children's inpatient unit, so probably best question for a children's hospital at this time.
Our next question comes from Aya Galal from Channel 3. Are the shortened CDC guidelines for isolating with COVID helping alleviate staffing issues? Are any elective surgeries being impacted?
The CDC guidelines are very welcome change right now, but we have not found ourselves in a position to use those guidelines to bring our positive colleagues back to work at this time. We are looking at it very carefully, and we'll see how it needs to be managed. But so far, the policy has neither helped or not hurt us in our managing our staffing so far. And regarding the elective or essential surgeries, has not been impacted. We've had few cancellations because the patients have turned positive in less than 5 or so across the system. But we've not had any reduction or in access or procedures which are essentials for patients at the moment.
Thanks, Dr. Kumar. Next, Tracy O'Shaughnessy is looking for a list of where and how residents can get access to Hartford HealthCare's testing sites. We can give you the website address for that. Dr. Carden, do you want to add anything?
Yeah. No, the best way to find it is going to be on the website. We have not posted the hours yet or other things, so I don't want to get premature. That will all be available as soon as we're ready to go. Just wanted to give you a time frame of when we'd be starting, but that detail will always be at the Hartford HealthCare COVID testing webpage.
More to come on that. Thanks, Dr. Carden. WFSB Channel 3 with the question, are there accuracy disparities between the at-home tests and in-person tests? Do the at-home tests deliver more false positives? Dr. Carden or anyone?
Yeah, I'm going to turn that over to Keith and Ulysses, actually, if that's okay.
Yeah, so there are disparities between the home tests and the in-person tests, but not in the way that the question is phrased. In this time of epidemiology where it's very high likelihood that people may be positive, we tend to take a positive test and interpret it as a real positive. Where the disparity happens is really the negative at-home test. A negative at-home test doesn't mean that you are truly negative at this point.
Our next question from Dave Altamari, the CT Mirror. Has the state asked Hartford Hospital to take over any of the SEMA4 testing sites or open new ones for them? Dr. Kumar, Dr. Carden?
No, they have not asked us to take over those sites. I'll answer that. Hi, Dave. We've communicated pretty clearly that looking at and being aware that there was increasing demand, that we were going to be opening up additional sites to just meet the needs, so that we've been coordinating as best we can with them as they're figuring out their plans, Dave.
Tracy from the Waterbury Republican American, how do more home tests blur the number of cases the state currently has?
I guess I can answer that. It doesn't blur necessarily the number of cases. It just means that there is a significant amount of diagnosed out there that is not being reported. But it's similar to, akin to, I guess, what was happening early on in the pandemic, where people were not being tested at all, but there was assumed to be positive. And so it kind of gets lumped into that pool. Unfortunately, there's no way to track all of these positive home tests at this point.
Jenna Carlesso from the CT Mirror, how are you handling elective surgeries, procedures? I know we touched upon that. Dr. Kumar, anything else to add there?
No, I think there's nothing else to add.
All right. Eliza Fawcett from the Hartford Current, how concerned are you about the surge in hospitalizations we've seen? Is Hartford HealthCare feeling the strain? How long could it take before hospitalizations begin to flatten out?
I'll take that. Eliza, we always are concerned about the hospitalization, and we always pay attention to that. These situations can change very rapidly. In 2 days' time, we may have a significant number, and we may have to react differently. But Hartford HealthCare remains very agile. We work with the incident command model across the system to manage the throughput on an hourly to hourly basis. At this time, I wouldn't say we are strained. We are managing throughput well, and we are making sure that our community gets access to the care as and when they're needed. But we are watching it carefully. In 2 days, the answer could be different, but right now we are doing okay. And we've done very well during this holiday time as well.
Follow-up question from Tracy. Could you explain why so many people who have been vaccinated and boosted and are still getting COVID? Some have said the vaccine isn't working. Could you address that feeling? And could you tell us how the changes in the spike protein that Omicron has affected the protection conferred by the vaccine? Dr. Wu or Keith?
Yeah, I think I touched on this a little bit earlier. So ever since the advent of the vaccines, and I'll say it again, just to emphasize the point is not to prevent disease and prevent transmission, although that is a added side benefit. Its main goal in the studies was to look at keeping people from suffering from severe morbidity and mortality associated with COVID. And so the vaccine is absolutely working. If there was no vaccine, these numbers that we are seeing now that seem large would pale in comparison to what it is. With regards to the spike protein, so there are several mutations that really make it more transmissible at this point. And so that's the reason why getting the booster is actually very important, because it allows, so I guess I'm trying to think of the best way to say this without getting too sciencey on everybody, but I think think of it in terms of your antibody saturation. And with the primary vaccine series alone, maybe not enough antibodies are present in enough quantity to protect you against Omicron. But with the booster, you will be able to have enough antibodies to protect you. So I think that's maybe the best way I can explain it. Unless, Keith, you have a better way.
I mean, one of the data that I really want us to keep focus on is keep in mind the majority of individuals who are in hospitals, not just in the hospital, but are in a critical care setting. And the reason why I say not just in hospital, because that number is it's somewhat skewed in that we're testing everyone. So we have people within the hospital that are here for something completely different, nothing to do with respiratory disease, but are here and they're positive based on the fact that they're tested on admission and test some days after. The individuals that are in critical care that need support, the vast majority of those individuals are individuals who are not vaccinated. So as we identify or breakthrough cases and a lot of people that are positive, that have been vaccinated or positive, it's still, the statistic and the data still points to the efficacy of this vaccine, and most importantly, the booster itself, as in a number of individuals within the hospital system that are positive right now, most importantly, needing critical care, are individuals that have not been vaccinated.
And Rebecca gave she reminded us of some of the good analogies we've used in the past, which is the vaccine is very similar to the seatbelt, where it doesn't prevent the accident, but should you get into the accident, it prevents morbidity and mortality. I will spare all of you my NFL analogy right now because my team lost Sunday. So,
but you've educated this group on sports, so they're all ready for your sports analogies. Aya from Channel 3, with college semesters set to resume later this month, what guidance do you have for universities? Should boosters be required? Keith or Dr. Wu?
There are many more things that go into the decision for universities whether or not what their decision making is with regards to COVID. From a science standpoint, with Omicron prevalence, I will just keep it simple and say boosters are very helpful in the fight against Omicron. Keith?
I mean, I absolutely agree. There's a number, we're a part of a few of these discussions, and there's many things that needs to be considered. And, you know, the booster certainly as a process of helping definitely should be considered as well.
Jordan Fenster from Hearst, Connecticut Media. Again, Dr. Wu talked about the disparity of negative tests and testing supplies are limited. So how should testing be used? Should symptomatic people test only if there has been an exposure?
So the disparity of negative tests. So how should the testing be used? The testing it's an important part of the fight, especially with regards to our positives. However, this goes back to the suspicion whether or not you actually have COVID or not. And so if you have a negative test, my suggestion would be you go seek out additional testing that may be better, whether it be antigen testing or preferably PCR testing. The other reason that you should probably see somebody is there are a lot of other circulating viruses that are circulating, sorry to be redundant, influenza being probably the most consequential of that. So if you are testing negative for these, but you are having symptoms, you do want to look for other causes that may be causing your symptoms, and especially influenza. Oh, I think I answered the next one by mistake. So I apologize.
No, that's fine, the WFSB one. So we'll go to Caitlin Burchell from NBC Connecticut. For Dr. Cardin, regarding these new testing sites, do you have to be a patient of Hartford HealthCare, or can anyone go to these new trailer locations?
Anybody will be able to schedule and go to these locations. We are asking that everybody schedule an appointment to stop and to avoid the long queues that congested us before. But this is not restricted just to Hartford HealthCare patients.
Okay, Tracy has a question from the Republican American. We have read reports of shortages of COVID treatments. Is that true? Are you affected?
Tracy, can you elaborate? What do you mean by COVID treatment? I don't understand.
We'll have her elaborate. We'll go back to Caitlin. Is there a cost, Dr. Cardin?
It continues to be no out-of-pocket expense for folks who get tested, yeah.
All right, Dave Altamari from the CT Mirror. Are you still getting adequate supplies of monoclonal antibodies?
Ulysses, you want to take this?
Yes, absolutely. We do have adequate supply of monoclonal antibodies. However, there is a but, and the but is with the previous monoclonal antibodies against the previous variants, including Delta, we have plenty of supply of. There is other treatments that really have efficacy against Omicron, and that production is actually still being ramped up. And so some of our monoclonals are in, I don't want to say short supply, it's just they were never in large supply, and we're waiting for that to be ramped up. So they are in limited quantity at this point. And sorry, that answered, I'm just moving on to Tracy's there.
Yep, that answered Tracy's as well.
Yep.
All right, Dave Altamari, follow-up question. Are the new trailer testing setups going to be PCR tests or the rapid tests that your urgent care centers are using?
PCR. And I did peek ahead at the next turnaround times. We are anticipating and will continue to strive to keep them under 48 hours. Generally, when we do this trailer testing where we're sending them to, we get that kind of commitment. I realize that some of the commercial tests are getting very long turnaround times, but our commitment is still to be less than 48 hours.
All right, Tracy, another follow-up question. Can you be more specific about the monoclonals? Is there a shortage, or is it that some don't work against Omicron?
Let me explain on that part. Tracy, essentially, we have older and the newer monoclonals at the moment. Given how the prevalence of the Omicron has been reported in Connecticut, we've utilized both of those in appropriate settings. We do have supply for both, but obviously, as the demand goes up, it's a catch-up we're playing every single week with the supply as it comes through. So I don't want to pass a message that we have a shortage here. What we have is appropriate supply right now, and we're managing supply and demand at this time. What we can't tell is what the next week will look like, because the positivity rate keeps changing in the state of Connecticut, and obviously that may affect the demand on that part.
Jordan from Hearst CT Media, how is supply of the new antiviral pills?
Jonah, it is limited at the moment. We have some supply, and I think we will see how it evolves over time. But we have some within Hartford HealthCare right now.
Great. We have another question from Dave Altamari. Any sense of how long you expect this wave to last?
Well, Keith Grant, take a shot at that.
You're good. You're good. That was a good one.
We all vote for Keith.
Passing it off.
5 to 6 weeks. I think we'll see. The rate of increase will decrease, however, but we do believe that somewhere in early February we should start decreasing at a good rate. Some interesting data coming out from the UK in that, and we talk strongly about the fact that we trend very closely to the epidemiology in the UK. We're about 6 to 8 weeks behind for the most part, sometimes I'd say 4 to 8 weeks behind. They had a sharp increase as we have, and they've also had a sharp decrease as well. So we're hoping to see the exact same thing. However, the rate of change that we've appreciated has been somewhat sporadic. It hasn't tapered off yet. But we do believe within the next few days or so, we should start tapering it off. However, that being said, one of the things that we have to appreciate is the epidemiology from the holiday season. So we should see some increase based on that. And that's one of the things, we are ensuring that, as always, we're prepared to manage that from a healthcare perspective.
I think I've talked to some of you before that, we would expect to see what we call the tri-humped curve as we wind down from Delta, as Keith has correctly pointed out, due to the holiday situation that we certainly have seen. We should expect to see an increase in Omicron. Now, it really depends what you mean by this wave in terms of hospitalizations or in terms of positivity. We should see an increase in positivity from Omicron, but we are hoping that Omicron does not result in as many hospitalizations. And then we have the specter of influenza that usually peaks around mid-February, early February. So that would be the third hump that we would be looking at.
All right, thank you. I don't see any other questions in the chat, so we'll just start with final thoughts as we conclude. Keith, do you want to start?
Yeah, absolutely. Again, every time we get on this, I hope we have some better news. I think one of the things we can say, if you look at, I just looked at what we talked about last year this time, and one of the things that we speak strongly about, there's many unknowns. I think at this point, we're more knowledgeable. So we're significantly more knowledgeable. We're more resourceful. We have a lot more tools to include our boosters or vaccinations, to include our monoclonal treatments, to include their different therapeutics. And we also are more appreciative of the fact that the things that we figured out very early still work. So proper isolation, early testing, recognition of symptoms, proper use of PPE to include a mask still works very, very well. And the last thing I will say is be very aware of your personal risk assessment. We continue to see the majority of individuals that are hospitalized with this disease are over 65 or have existing comorbidity, to include being immunocompromised. If you have individuals within your family that falls into this spectrum, encourage them to get vaccinated, have good conversations with them about being safe, and be safe around them as well. That's all I have.
All right, Dr. Wu. Thank you, Keith.
Yeah, I'm just going to reiterate exactly what Keith has just said, because many of you have talked to me before. It's very simple. Nothing has changed since Delta. Nothing has changed since the beginning of COVID. We have measures that we still do, that we are still going to use to try to combat this disease. That's masking, very important. Vaccination, boosting, social distancing, and not engaging in those risky social behaviors. That is tried and true. All of these, nothing has changed. That's the message that needs to be put out there.
Well said. Thank you, Dr. Wu. Dr. Cardin, final thoughts regarding testing.
Thank you all for patience in terms of as we get stood up. I do think that we'll be able to meet the demands around that and to ensure that keeping people safe. I also do want to add to continue to stress that to not have people interpret this surge to avoid other symptoms or other problems that they may be having. You know, when we saw the ramifications of the first wave of all of this and all the people who deferred care and the significant morbidity that resulted, it was a real challenge. And so we want to make sure we're staying in front of that. And that if people are having problems or issues unrelated to COVID, that they're seeking out their clinicians and getting the advice and making sure they're getting the care they need so that chronic issues don't become acute problems.
Very well said. Don't delay care is the point we definitely want to make. Dr. Kumar, final thoughts?
I think the team has covered all the things very well. I'll just add one other comment that the Hartford HealthCare has the capacity. We're managing our throughput, our access very well, and we are keeping a very good eye on that. So I want reassurance. I want to reassure the community that as a system, whether it's a behavioral health, community network, medical group, virtual care, our inpatient and acute setting, all those areas are open and ready to serve our community at this time. Despite this increase in numbers, we have not seen a strain to limit any of those activities so far.
All right, we don't have any further questions. I want to thank the media for joining us today, and of course our panel of clinical experts for assembling today. And we will continue, as I said at the beginning of the briefing, to hold these every day at 11 a.m. So we encourage you to attend and ask all of your questions at this time while we do have our experts available. So for now, thank you for joining, and we'll see you tomorrow at 11 a.m.